Welcome back. Now in this evening's health report, Shamila Pullen looks at bleeding disorders.
Bleeding disorders are conditions where the blood does not clot properly, leading to excessive bleeding. When one gets a cut or injury, the platelets in your bodies, which are small blood cells, form clots to stop or prevent bleeding. Some bleeding disorders are inherited, others develop later due to illnesses.
In Jamaica, we estimate that there might only be 200 patients, but if you don't treat those patients properly, if you don't diagnose them and treat them properly, you end up with a significant burden on society because they're not able to work, they're not able to go to school, and they end up with major deformities, which limits their ability to function. And again, we're talking about males, we need the males to work.
Complications can include bleeding in the brain and other problems depending on the specific disorder.
So if you have a person with hemophilia who comes in with some of these complaints, then you should actually treat them with a clotting factor replacement, and then you can send them for the testing. Another common site of bleed is in the muscle called the psoas muscle. So if they have a bleed on the right side, it often mimics appendicitis. You don't want a surgeon going in and cutting that patient. What you actually have to do is give the clotting factor replacement because it is likely that this person has a bleed, and then you can investigate and confirm that it is in fact a bleed.
Treatment depends on the type of bleeding disorder you have.
For hemophilia, we give the clotting factor concentrate that's the patient is missing. So there is commercially available factor 8, there's commercially available factor 9, and if somebody comes in with a bleed, we determine, is this bleed a major bleed or a minor bleed? So for the minor bleeds, maybe we can just give 1 dose of the clotting factor replacement. For the major bleeds, we usually would have to admit those patients and give them multiple doses several times a day in order to stop the bleeding.
With your health report, I'm Shamila Pullen wishing you good health.